Hi, everybody. I apologize for that breakup on Collaborate. I'm sure I will get to fix that by our next session. If not, we'll work something else out. Again, my name is Matthew Sobel. Welcome to the course. I've been teaching this course, I think, since 2011. I actually kind of forget. Last summer, Dr. Horvath and I, Lewis Horvath and I, agreed that we were going to mix up this course a little bit. It used to be very heavy in epidemiology and mathematics, very complicated calculations, and we kind of decided that we wanted to move more towards public health theory. So technically, the course is still called epidemiology and community health, but we're focusing more on public health now. I'm not going to read through all of this. I did want to go through just basically how the course is going to be laid out. As far as, we're going to be doing a lot of discussion posts every week. We'll take a look at the due dates here in a minute. There's going to be 7 tests uh, for the first 7 course modules, the first 7 weeks, and then there will be no final exam on week 8. The final project will constitute our final exam. Human subjects training, that takes about 3 to 4 hours. I would suggest you get started on it sooner rather than later. All the instructions are in, I think, course module 6. It is 5 or 6. I can't remember. And then I'll talk more about the PowerPoint presentation and the article critique. I'll give separate presentations for those things. These are the topics that we'll be talking about. Again, as far as the assignments, the first 5 weeks we have a test and a discussion each week. Those dates there are the beginning dates, the Mondays, and then the due dates are over here. So May 8th, Sunday by midnight. Try and get everything in Sunday by midnight. I like to have everything graded and grade center updated, hopefully by Monday evening or so. That's not a guarantee, but that's what I try for. So, like I said, the first 5 weeks are tests and discussions. We'll take a look at a test actually briefly here. And the discussion, your original posts, and then your responses to your peers. Make sure you have those all done by Sunday. Um, and then, as I said, the human subjects training, the article critique, and the PowerPoint presentation I'll cover. I'll give you some more information about those. But you can find examples of those assignments that were completed by previous students under the syllabus tab, and then there's another folder there entitled course content. I apologize, I can't even get into my St. Joe's website right now. Everything is completely shut down, or else I would do this as I'm talking. So there's the due dates, okay? Sunday by midnight. Again, I know we're all working adults, so if you have something come up, just give me a heads up and we'll work something out, okay? Uh, and then here's the rest of the syllabus. Again, this is all pretty straightforward, so I'll let you read through this on your own. And I think I want to just jump right into how the tests are going to be laid out. You probably all saw these before. We did have these in the system in Blackboard as an online test that was timed. I think it was 90 minutes. There are too many quirks within the system itself, and just these tests are not ideal because they're standardized tests. So sometimes some of the wording is a little tricky. So with that in mind, what I would suggest, these are unlimited time. You have take as much time as you want. Read very carefully through the textbook. Make sure you're listening to the Collaborate sessions because I cover a lot of the answers, or some of the answers at least in here, or at least point you in the right direction. If there is, some of these are going to be obvious. If it's something that you think is not obvious and you're not sure, provide a reference to justify your answer. And even if you're wrong and your justification is, you know, somewhat legitimate, I'll consider partial credit. Okay? So again, highlight the correct answer. I suggest that you, if it's something that you're not sure about, put a reference for what you. And then, like I said, some of these are not great questions, and some of them I just don't count. So we'll talk more about that. There's kind of a built-in curve for this. So that being said, let's go real quick right into chapter 1. There's just a few things that I wanted to discuss. Um, so first of all, what is public health? I know I gave a brief overview of this. I'm going to kind of skip through this. I'm not going to go through the history. You can feel free to check that out on your own. Uh, I'm sorry, I'm trying to read through this real quick. Just differences in life expectancy between improvements in life expectancy. in 1900, the life expectancy in the United States was probably about 50, and now we're up to 80. So a lot of really good news. In the 1900s, most people were dying from infectious disease. Infectious disease was rampant. If you look at the 1919 influenza pandemic, happened probably started in the trenches of World War One, and then went essentially pandemic and went all over the world. It was there's concern that that could happen again. We'll talk more about that. But really, if you look at this, infectious disease was pretty much wiped out, or not wiped out, but had significantly decreased even before the first vaccine came around. By the time Salk came around with his vaccine, which of course was wonderful, and of course it lowered the rate of, continued to lower the rate of infectious disease, but most of the infectious disease was cleared up with public health measures, other public health measures, including clean water, especially, and clean water was probably the biggest one, and improvements in nutrition, of course, but clean water was the big one. Sanitation, wastewater treatment, and then drinking water, clean drinking water. That was the main thing that drove down that infectious disease rate, without question. So vaccines are important, don't get me wrong, but most of the infectious disease that still occurs in this country, or in the world now, occurs in places that don't have clean water, unfortunately. So vaccination, of course, is important too. So again, I'm going to kind of skip through some of these. Feel free to read through these on your own. We're going to talk about the social ecologic model for a minute here. Again, I'm not going to skip through this. Core functions, of course, is important, but again, you can kind of read through this on your own, and we're going to get into that. This is really what I want to talk about, the social ecologic model. It's the idea that a person's health is not simply based on their genetics or their personal lifestyle choices, but it's based on the infrastructure of the society that they're living in. So it is, of course, if you start in the middle there, that's center circle, it's our individual traits, our gender, how old we are, any genetic factors, there's certain things that affect certain races, biology of disease. And then on top of that, do you smoke? What kind of diet do you have? Do you drink? Things like that. So your individual behavior, exercise, and then a social support system on top of that is extremely important. Do you have a strong family support system? Do most of the people in your family smoke or drink alcohol? Because we know that that's going to increase your risk for use of those drugs. Do you have a strong, social support system? Going to church seems to be extremely beneficial. I mean, there's probably a variety of reasons, but just for the social network involved in going and praying with a group of people every week. So having a strong community is a strong, healthy community is a predictor of health. Proper living and working conditions, of course, and then all of the from a larger scale, from what the government policies, things like that, environmental conditions. And government policies from a local perspective and a global perspective as well. All these things are going to combine together to influence our health. And we need to consider this because, especially with things like the obesity epidemic, a lot of people think the obesity epidemic is just a crisis of personal responsibility. And there's no question that personal responsibility comes into this, but all these other things come into play too. Take a look at any supermarket, and 70% of the food is known to elevate risk for disease. So, junk food is being sold all over the place. So we need to take more of a social look at this and hopefully increase our education systems or improve our education systems and things like that. So this is the idea behind population health systems. Again, I'm going to skip through all this. Public health people love to use these kinds of flow charts and things like that. I don't think there's anything right now that we need to worry about for this. Again, I apologize. I'm kind of skipping through this just because you can read all of this on your own. The 10 great public health achievements. So this is from the CDC website. All these are important. Immunizations, of course, they always put that as number one, but that probably is not as important as some of the other ones. Fluoridation of drinking water is questionable now. Fluoride can seem to protect teeth, but there might be some other side effects that may cause some downplay. We'll talk about that a little bit. Control of infectious disease, of course. Workplace safety in the United States has been wonderful. Workplace safety in other countries has not been, and a lot of our production now got exported to these other countries where there are no workplace safety measures in place, and that's why there's all these accidents and things like that. So that's why our products are so cheap, because these other countries don't have that workplace safety. So a lot of healthier mothers and babies, things like that. In some parts of the country now, unfortunately, maternal mortality is actually on the rise, and again, it's the result of the obesity epidemic. Some of these things are questionable. Some of these things obviously are great. I don't see water on here. Is water on here? I apologize. I should say water. I have a Philadelphia accent. Uh, Decline safe and health foods. Yeah, it says fluoridation of the drinking water. I would say just not necessarily fluoridation, but clean drinking water, and certainly the cleaning of the wastewater systems has been a huge public health achievement. I don't know why they specifically put fluoridation in there. Again, it's somewhat questionable. Harvard actually did a study recently that found fluoridation decreased IQ. It was a study in China, and they found that the Chinese children that were drinking fluoridated water actually had lower IQs. So that's a little scary. I can provide that reference. Obviously, I don't have it off the top of my head. So chapter 2 goes into population health. Again, I'm not going to read through all this. There might be something in here that... So overall, our health status is improving. We do have a slightly longer life expectancy. Our life expectancy, there's another term. It's healthy years life expectancy. The life expectancy or how many years you can expect to live without disability, and that actually decreased by a year, unfortunately. So we're living longer, but we're living a little sicker, unfortunately. So again, there's been a shift away from infectious disease over to chronic disease because we're living longer than we ever have before, and so we're more prone to these old age, essentially, diseases like cardiovascular disease, dementia, and cancer. So that's why these diseases are essentially really prominent right now, and those are the biggest concerns. So overall, our mortality trends have been going down, which correlates to a higher life expectancy. So we're doing good. We're getting better in the United States and abroad. In other countries as well. It's not always the same across all ethnic groups, unfortunately. This is interesting, though. Life expectancy trends. If you look at the Hispanic, male and female, they have the highest life expectancy. So life expectancy, there's no question that socioeconomics impacts life expectancy. But this is what we call the Latino paradox, or the Hispanic paradox, because although Hispanics tend to be in a lower socioeconomic status than most Caucasians, still they have a higher life expectancy, and they think it's the life. Again, going back to the blue zones, it's the lifestyle choices. They eat more of a plant-based diet. They have a strong social community network, probably a few other things as well. So some really interesting things in the data when you pull all these things together. Life expectancy in the United States, this is kind of hard to read, but overall we're not, considering that we spend more money than anybody else in the world on healthcare, we're not doing very well. It's kind of hard to read this, but we rank about 27th in the world in life expectancy. Japan and Switzerland are up at number 1. And they tend to switch back and forth, but we've never cracked 25. We're always below 25, unfortunately. So again, mostly due to the Western diet. I think I'm going to skip over some of these. Again, you can read these on your own. Tobacco use. This is kind of good news, a major public health achievement, at least in the United States. We've significantly reduced the number of smokers in the United States. But unfortunately, when we did that by cracking down on advertising. What the tobacco companies did is then shifted their advertising to other countries. And now a lot of people in Asia and other parts of the world are smoking a lot more. So 43% of men in the world smoke. So this is the most productive time in the tobacco industry history. They have more money now. They're making more money now than they've ever made in their entire history. and it's because they're mostly selling outside of the United States. So good news for us, bad news for everybody else, unfortunately. So some other things here. Again, I don't. I'm going to kind of skip through this right now. This is follow through these flow charts. Public health people love to use these flow charts, and they are interesting. And you'll have to kind of read through some of these to get your tests. This is just some of the impacts of different social and behavioral risks. So poverty is really bad for your health. That's basically what it comes down to. Poverty is worse than anything else. It's worse than being a current smoker. It's worse than being obese. It's worse than anything else. So it's just being poor is bad for your health. That's how everything, and it's called health disparities, and there's all kinds of words for it. We'll talk about that a lot more throughout the semester, but hopefully some of these public health programs that we're going to develop you'll target, some of the lower socioeconomic areas. Again, I'm going to skip through a lot of these. Again, you're going to have to read through this pretty good for your test. I just want to, I think that was pretty much it. Okay, so again, I apologize so much for the system flaking out on me tonight. I'm sure I'll get it squared away, and hopefully this was helpful. Take care.